Hi, Tonya. How are you?
Hey, good, thanks.
All right, what we're going to start off with first is checking your plaque retention on your teeth. Now, you've had this done in the past, which we frequently do because you have braces. So you're familiar that it's a pink substance that will show areas that you need to work on with brushing and flossing. Open for me. Okay. Okay, I'm going to bring you up. You can see. Okay. Let's just take a look. Open for me. All right. Seems as though you're doing a nice job on the linguals, which is the tongue side of the surfaces, your teeth. But where you need more work is right up in the front. You see where this plaque retention is, this bright pink? It's right by the gingival margin, which is the margin of your gum tissue. You're actually even doing a nice job in your molars. I think we need to work on this. What we're going to do is go over brushing. Again, this is more a review for you. To get the gingival margin better, you can angle up if you can, just slightly. I know the brackets are in the way. And you're not going to scrub too hard with the brush, but you're going to more or less jiggle it very lightly. And with the braces, you have to actually do a little bit more work. You have to come down the opposite direction and get under there. Which I can see that because this brush is so large, that it's making it difficult for you to get where you need to go, even your gum tissue itself, because I can see it as I'm doing it. So I have an alternative method. This is called the end tuft brush. And what that does, it's a little more smaller and compact, and you can actually get underneath your brackets easier. You can see it go down underneath and up. And it's actually getting your gum tissue. I want you to try it out for me. Excellent job. Okay, we're going to review flossing with you. I know you've been accustomed to using your floss threader, which I'm just going to go over the areas because you still have areas in the front here that need to be addressed. So we're going to bring this floss through. Pull one side out. Bring it up and around. Down, up, and around. Just like that. I'm going to actually have you try that out for me. Making sure you can maneuver. So we're also going to go over nutrition. How are your eating habits at school now? Pop. How about your pop drinking? Are you a pop drinker?
Yes, I am.
How many times a day would you say?
Like maybe 4.
4 times a day? Okay. Pop is one of the worst things you can have, and I know it's located around the corners at every hallway at school. What pop is bad for you is for 2 reasons. One is that it contains acid, so what it does is kind of wear down your enamel, and over time you kind of lose your natural anatomy of your teeth, and what you want to do is maintain natural anatomy for function and for aesthetic appearance. So if at all possible, And also it kind of thins it out. So, and you don't want to have thin enamel. You want your enamel to be as close to as the way it is now as you can possibly have it. Also, bacteria in your mouth thrive off of the sugar that you're ingesting and eat away essentially your tooth enamel when you're drinking your pop. So it creates what we call an acid attack, and that demineralizes the natural minerals in your tooth. And what you want to do is trying to create remineralization, which is bring it back to the level of normal pH in your mouth. So if you're drinking Pepsi for 30 minutes a day, or 30 minutes at a time, you're having an acid attack for 30 minutes plus an additional 20. So it's 50 minutes total that the acid is attacking your teeth. So all based off of the sugars in your mouth. How about snacking, or your snacking habits?
Potato chips.
Potato chips, is that frequently throughout the day? Is it at school, at home, or both? At school mostly. The problem with potato chips is that they're highly retentive and they tend to stick in your mouth. So they're going to stick in between the braces. I'm sure you've noticed this.
Oh, yeah.
So what you're going to want to do is tend to stay away from those snacks, but I know it's difficult to completely go ahead and just quit eating your potato chips. So some things that I would supplement in between there would be rinsing out with water, drinking a lot of water. Try and supplement your Pepsi with 1 glass of water a day or 1 bottle of water, or even Diet Pepsi would be good. It still gives you the acid production as far as its acidic nature, but you're getting a artificial sweetener, so you're not getting the sugar intake as you would with normally drinking Pepsi. So cheese neutralizes the acid in your mouth, so cheese is a good one. Plus you have braces, so it's nothing hard that's going to interfere with your brackets or your wires. So cheese is a good one. So if you can pack cheese along with your potato chips and eat a couple of pieces of cheese, it'll bring your pH back to normal. Milk also remineralizes. So if you could substitute another glass of pop with milk, if you prefer milk over water, that's still better than just drinking the pop. So, any questions for me? Concerns about your nutrition? No?
No, thank you so much.
All right.